So, Dr. Pontell, how much does a rhinoplasty cost?
So in our practice, the charges range between $10,000 and $15,500. That's the surgical fee. Then there's an anesthesia and facility fee, which can be in the $2,500 to $3,500 range.
Okay. What is recovery like? How long is the downtime, and will I have much pain?
So the recovery really is not bad. I'm not going to say there's zero pain, but patients typically do not complain of a lot of pain. Most of us have bumped our noses at some point, and it can be very painful when that happens. But that would make you think that having a rhinoplasty, a surgical rhinoplasty, would be very painful. But the reality is, patients really do not complain of significant pain. We give gentle pain medication like Tylenol number 3. Some people just take plain Tylenol. So yeah, it really is not a difficult or painful recovery.
Will I still look like myself after surgery?
Yes, I think patients still look like themselves. The biggest part of our face that distinguishes us from other people is our eyes, and our eyes do not change during rhinoplasty. Obviously there'll be some change in your appearance, but a lot of people would just think that you look good, might think you changed your hairstyle or got different glasses, but not really know what exactly changed. Most people look at us as an entire unit, not as individual features. So unless you have a feature that's really out of the ordinary, people again are looking at a whole face, not just an individual feature, and they don't remember that your nose was slightly droopy or slightly upturned, or the little details that may bother us that we fix during surgery.
What's the difference between an open and closed rhinoplasty, and which is better?
So closed rhinoplasty is an older technique. Open rhinoplasty, a newer technique. Open rhinoplasty, there's a small incision in the columella that allows us to lift the skin up and really look at all the structures of the nose and make very accurate, very precise changes. It allows us to be, to do a much better job and to do a more sophisticated rhinoplasty that will stand the test of time.
Can this surgery fix my breathing?
Absolutely. We have a lot of patients who have breathing issues, and we're working on the septum, working on turbinates, which are these structures inside the nose that can cause some nasal obstruction. So yeah, it's pretty frequent that we're working on breathing issues at the same time as a aesthetic rhinoplasty.
When will I see my final result?
So if you Google that question, you're gonna find out that it takes a year to see the final result. The reality though is that I would say in 6 weeks, you're seeing the vast majority of the full result. Even right when the cast comes off, you have a good idea of what the result is going to be. Swelling, again, is present immediately after surgery, but the vast majority is gone after 6 weeks. And patients are typically back to work after just 1 week and looking presentable.
What about a liquid rhinoplasty? What's that?
Yeah, so we use fillers, usually Restylane, to add volume to certain parts of the nose to balance things out. So if somebody has a bump on their nose, we can put filler above the bump and below the bump to make it look like the bump isn't there. Or if someone has a depression on one side of their nose, we can put some filler in that depression to improve symmetry so that each side looks the same.
And what if I had a rhinoplasty but don't like the result? Can I get it redone?
Absolutely. We do a good number of revision surgeries in our practice. The vast majority of those patients are patients who had surgery by another doctor for their first surgery. But we've done over 6,000 rhinoplasty between myself and Dr. Wang, and we have a lot of experience doing revisions.
How long do I have to wait to get a revision?
So typically we would wait at least a year for all the swelling to go down and really see the final result.
Cool. Thank you.
Thank you.